And welcome back to Wellness Central, this time where we bring you the latest health insights and stories that matter. Today is World Lupus Day, a moment dedicated to raising awareness about a chronic autoimmune disease that is often misunderstood or entirely overlooked. Lupus affects millions of people worldwide, and yet it remains one of the most misdiagnosed and underreported conditions. For many, the journey to diagnosis is long and filled with uncertainty, fatigue, joint pain, rashes, and internal organ complications that are often, sometimes too often, brushed aside.
And of course, but beyond the statistics of real people living with a disease that affects not just the body, but the mind, livelihood, and the quality of life. To help us better understand the silent toll of lupus, what warning signs to look out for, and how we can support those affected, we are joined in the studio by Dr. Olawale Ogunlana, a public health advocate. Thank you for your time.
Thank you. Thank you for having me. Yeah.
I mean, lupus, for our viewers at home who maybe are just hearing this for the first time.
Okay.
What is it about?
So, lupus is one of the diseases that are classified as an autoimmune disease, and I think it's very important for people to understand what autoimmune means.
I was about asking that.
Yes. So, when we say the body has an immune system, which is like a defense mechanism of the body, which acts like a first-line response to infections or toxins or anything, right? So, but in the case of autoimmune conditions, this defense mechanism turns on not infections this time around or bacteria or toxins. It turns on healthy tissues and organs of the body. So it means that it begins to recognize the healthy tissues of your body, the cells, that is your eyes, your lungs, your heart. So the tissues around, your organs, it recognizes them as foreign and it begins to attack them.
So it's like the body fighting against itself.
So it turns on itself and it starts fighting. So that is exactly what autoimmune condition looks like. And the thing about lupus is usually called a disease of 1,000 faces because when we talk of lupus, we are talking of systemic lupus erythematosus. That's like the full name of the disease. And it has different, because what we mean by it's a disease of 1,000 faces is that it has different presentations because it affects different parts of the body. So it's systemic. So that is where the name systemic lupus erythematosus comes from, because it can show as a rash on the face. It starts usually with fever and joint pain. Some people would think it's malaria. Some people might just think that they are ill, they have a flu. But whereas, essentially, that is one of the reasons why it's one of the misdiagnosed disease conditions in the world, because it can present no two systemic, no two SLE cases are the same.
Okay, so is it hereditary? Can it be contracted?
Okay.
How is it acquired?
So in most cases, especially in this part of the world, it tends to be genetic. So some people tend to have it due to genetic factors. There are also certain
genetic makeup, not necessarily it's been hereditary.
Yes, and then there are also some different environmental factors that could lead or cause that disease. But
for example, to pneumonics.
But the whole general idea is that when it occurs, it can be quite devastating. And when we talk about the systemic effects of SLE or lupus, it ranges from something as simple as a skin rash to something as severe as kidney failure. Yeah, so that's the range.
So for instance, what are those like physical signs or you see on your body to know it's lupus?
Okay, so in cases of SLE, so there are different forms of the symptoms that people can recognize. But when we want to diagnose the disease, a lot of things have to be put. There are a lot of criteria that have to be put in place. It's not you can't just have a skin rash and then I'll say it's lupus, right? There has to be a certain amount. There is a criteria for diagnosis, and each of those criteria have different things that need to be done. For instance, skin rash is one of the things that people can notice. There's a certain pattern of skin rash known as the butterfly rash that appears on the face in people that have lupus. It can also be on their, it can be on their fingers. They can see it, around their fingers. There can be issues with joint pain. Many times they do have complaints of joint pains, like severe joint pains. There could be fever, there could be muscle pains, there could be fatigue or tiredness. And all the symptoms that I'm currently mentioning now are symptoms that people would probably experience when they are having something like malaria, right? But then this happens on occasion, and when you go to hospitals and you get checked up, you realize that it is not malaria. Then what is it, right? Normally, the next goal is to proceed for further testing. But because people don't have proper awareness about it, they just feel that, it's because of my mood, it's because I've not eaten, or because of xenobonomics, like she mentioned. I love it. But then, because of these things, people think that I'm just okay. They don't see the need for proper further testing, like for instance ANA testing, that is for antibodies, testing for antibodies that are sensitive 90% of the time in cases of lupus.
All right.
So,
I know that this foreign artist, Nigerian-born British artist.
Who's that?
Seal.
Yes.
Yes.
He has lupus?
He has lupus.
Interesting.
with the face,
with the
yes.
face.
Yes.
But back home to Nigeria and testing, diagnosis or even testing, our healthcare system on the brink of, I won't say systemic failure, but unfortunately it is what it is. I can only imagine for those who are in underserved regions and have to reach regions who seem to have this type of condition may just be not be able to get diagnosis. What are the challenges, for Nigeria? Okay,
so one of the challenges that they face, especially for Nigerians with regards to SLE, is, there are no systems that are available for them, especially in the rural areas. So most times, because of the way the healthcare system works, we have the primary healthcare, then secondary facilities, which are the general hospitals, and then we have the tertiary facilities, which are usually teaching hospitals. So primary healthcare facilities are usually the first line of care in cases like this. And most times when they go, because of the huge burden of patients that they have to take care of, because of the lack of manpower, because it's not every hospital or primary healthcare facility that might have a doctor at that point in time. So because of that, there might be gaps, certain gaps that cannot be met. And then people go to community pharmacies. In fact, the first grassroots, when we talk about grassroots healthcare, it's usually community pharmacies, because when somebody is feeling ill, most times they don't go to the doctor immediately. They go to the community pharmacist. I beg, they feel headache. You get something for headache.
Or primary healthcare center.
Yeah. So, or primary healthcare center if they feel that they need to see a doctor.
Yeah.
But in community pharmacy cases, because those people, the people that are there aren't necessarily doctors or able to spot or say that, it's not just malaria, it could be lupus, right? Because of that, they just say, okay, it's a community pharmacy, so take this paracetamol, use it for the fever. And let's assume that in the presentation of a lupus patient, fever is one of the presentation, and joint pain. Of course, if you give the person Panadol or diclofenac, the pain will go, and then the person feels better. And when he feels better, they ask him the next day, how are you feeling? Okay, they do me again.
Right.
Whereas that was just a flare. And if it was an SLE case, it was just a flare. That is, the person is having a flare. That is, the symptoms are getting obvious, right? So, and then there is remission. But it comes back again. And when it comes back, it keeps attacking different other organs. And that is why by the time they discover that it's probably lupus that they are dealing with, the person is already coming with lupus nephritis. That is, the person is having, the kidney is affected. So people then, they now say, I cannot handle it here. Go to the hospital. From general hospital, they look at the case and they say that, this is a tertiary hospital case. So they move you to tertiary hospital. And when you get to the tertiary, this is just a scenario.
Yeah, it's just.
And when you get to the tertiary hospital, they'll tell you that, you came late. So you will need kidney transplant. So you see how the gaps, how these gaps cause ripple.
I mean, that would take me to the question of affordability in terms of the treatment.
Right.
You know.
Is there even a treatment to begin with?
Yeah.
Okay, so first of all, there's no cure.
First
First of all, yes.
No
So
cure.
for SLE and lupus, there is no cure, but the management is key. There are drugs that are currently available, helpful for the management, and then also, like I said, it's when we talk about management, we are not just talking about treatment. We are talking about the whole aspects of care in that is diagnosis, testing, okay, and treatment. So all of those things put in that context. That is actually what is needed. So yes, we have them in Nigeria, but then are they affordable? That is something that I can hardly tell, because I mean, Nigerians are finding it hard to feed. Healthcare is one of the last things that is, usually when you look at Nigeria, when you ask Nigerians what are the top 5 things, healthcare might not be there. Whereas health is supposed to be the number 1, because good health will allow you to achieve every other thing that you need to achieve.
I mean, this of course is a really core and pivotal issue. But in terms of awareness, and I'll stay with you on this, do you think enough is being done, particularly at even school level, basic education? Do you think awareness is there now?
Okay, so I would say there has been a lot of efforts towards awareness, but more still needs to be done. I personally feel that when we talk about awareness, a lot of people just feel that it's by having outreaches and reaching out to people, but it has to be in context. So what you tell somebody in the southwest area of Nigeria, for instance, shouldn't be the same type of information or the same type of context that you give in the north, because the way they live is very different.
And religion, ethics, their belief.
Language is very important. All of those things are context, and sometimes it can be very difficult explaining some of these things in individual languages and in local languages. So that is why there is still a barrier, at that level, and more still needs to be done. I will agree with you on that. More still needs to be done with regards to sensitization at the grassroots level, because that is where we really need to change. People like you and I can easily flip up our phone and Google lupus, and everybody will know that. But then when you go to the grassroots, the areas where there is lack of internet access, or people just have a dumb phone, not a smartphone, how can we contextualize information to people like them?
How dare you call my second phone dumb phone?
Don't be angry.
How dare you call my second phone dumb phone? That's a reliable phone.
Yes, but can you read PDF, though?
It's reliable.
Can you read PDF?
It can reach me. Let's talk about. Let's talk about. You said Google, right?
Yeah.
And I remember back in 2021, I don't know what it was. It started out like a small, it looked like a ringworm, which was very shocking for me, because I'm like, you met me, you know what I mean? And then before I know it spread out, and I started to get worried, and then itching all over my face, my body. And when I went to the hospital, they were like, they said, oh, it started out as that's the motherboard. I'm like, wait, what? I think my dream has come true. You know what I mean? Like, a spaceship came, an alien came, and the motherboard. Because that's what I thought. I was like, yeah, finally, science fiction. And then come to find out it's a condition. And then when they set the term, and then funny thing, I'd been Googling it, and Google kept telling me that's what's wrong with you. But also, all the pictures that were coming up were of white people. You know what I mean? And
yes.
I know I'm light skinned, but also I'm blackity black. Okay, so none of those things. And what I was seeing didn't look like me. And so I didn't understand it until I went to get the confirmation and diagnosis that, oh, this is what you're doing. You're like, oh, there's no treatment. It's going to give you an injection to quell the flares. And if you're having, something more to cool it, because the rash will just go by itself. Like, I forgot the name now. And so even when you're Googling, you're not seeing representation of yourself, right? And you're saying that this has joint pain, joint pain, headaches, fevers, and then the rash, right? When you Google and you see, because I'm looking
you
at,
see a white
person,
Yes.
So how then can we tell people what the symptoms are? What are you going to look out for? How do we educate Nigerians that are watching so that they are aware when they see somebody else and they know that this is it, gone,
Yes.
and you need to see it.
So that's a very good question. And I think this is where technology really comes in. I think I think about 2 months ago, I was introduced to a platform. So I think it's called Visual DX. Visual diagnosis, actually for healthcare practitioners, and it helps healthcare practitioners to be able to spot, skin presentations, especially in people of color like you and I. So one of the things that we are trying to use now is artificial intelligence to ensure that in cases like this, the presentations, when a dermatologist spots, a case of SLE with rash, it is uploaded, tagged, and put in that context. So this particular platform is intelligent enough so that when I will be looking or searching on that platform for the presentation or the classic presentation, I will be able to see I will be able to see its representation in you and I, in people of color. So that is exactly one of the challenges that we face currently, and technology is helping us to break that barrier and get access to it. But now, beyond that, with awareness, with literacy, health literacy content, with, like, for instance, what we do, one of the key things that we try to do also is to contextualize the information to ensure that when we are telling you about the presentation, we are talking about a disease, we are putting it in the context of people of color. That is you and I. Right. How does it look? How will it present? So those are the things that we are trying to do today to take care of it. These are still silos. They are not. It's not as if they are full blown. But we are hoping that with government support and support of other partners, we should be able to do this more, so that in the next 10 years, this will be a common occurrence.
When we were younger, we had an itch or a rash, or you had something or a patch around your skin. Unfortunately, in my neighborhood, you were literally, he has crocodile, don't play with that kid. You know what I mean?
Yes.
If I see you near that boy, that's what it was. And so there's a stigma that comes with such, right? Let's talk about that, and then, and also that fear. There's also this misconception that autoimmune disease means a death sentence, right? Because of oftentimes autoimmune diseases, there are no cures. So let's talk about stigma and also the sentence very quickly as well.
Okay, so let's talk about the stigma. I happen to know a warrior who also lives with the condition. And when she told me her story, it wasn't just the feeling of the stigma, but then it was the mood disorders, the fact that she dealt with a whole lot of psychological problems. So yes, there is the stigma, because sometimes these people are unable to cope with normal tasks that you and I will be able to do. For instance, we are sick and we get well easily, but then for them it's flaring up. For instance, they can be having skin issues today, and then tomorrow they are having tiredness and fever and joint pain the next day and all of that. So they don't know what they will expect because of how SLE is, because it's systemic in nature. It can't just affect one particular organ. So before you know it, they are having symptoms. Oh, my back is paining me. Oh, my chest is paining me. Oh, everywhere is paining me, all at the same time. So because of that, they don't even know what to expect with the disease. And based on that, it can weigh their minds down. When they want to do a task, they start thinking that, what if I fall sick, right? Okay. So that in itself weighs them down, can put them at risk of depression. And when she was telling me her story, I felt really for her, because how would someone be able to cope with such kind of challenge when you don't know the next day if you are going to be better? Right? So, and then there is the rash, like she mentioned, where people have to deal with rashes, and then they have to face the stigma. Oh, you have this. Oh, don't touch me, that kind of a thing. And not knowing that this rash is not contagious, right? So people have to deal with such level of stigma. And the fact that, the last question that she mentioned, autoimmune disease is not a death sentence. The most important thing is the knowledge and ensuring that, I would say this, that if you treat a particular thing, a particular symptom 2 times, and it appears again, and it appears that you're sick, usually it is time to screen for SLE. Okay. Usually that is the best. So when you've done all the necessary things for a particular disease and you see that it's not going, for instance, the person was complaining of chest pain and you did every manner of things and it did not get better, then the next thing to do is to screen for SLE. And then another final thing that I want to mention on the show, there are certain medications too. People have to take note of that can put people at, that can trigger SLE or lupus. So yes, antihypertensive medications like hydralazine, captopril, those kind of drugs. Antibiotics like isoniazid, which is used in the treatment of tuberculosis, is very important. So for anyone who is on those kind of treatment, if you notice any of those symptoms like skin rash, joint pains, the moment you start using any of these medications, it's important to report it to your doctor immediately so that they can, remove it and ensure that those symptoms can be taken away.
Afterwards, you write the names for me, yeah?
Yes, no problem.
I must say thank you so much, Dr. Ogunlana, for just taking out time to join us. We appreciate you for coming on.
Thank you so much.
Remember, it's not a death sentence, okay? Make sure to reach out to your doctors. If you see that those signs and those symptoms you're having seem to be recurring and you're on the third time treating it, it might just be an autoimmune disease. But that's all we can take.